Hey, good afternoon, everyone. We're coming at you live today from Revitalize You here in North Liberty, Iowa. Today we're going to be doing a liquid rhinoplasty. So you may have seen this online. It's using filler in order to change the shape of the nose in the office in only a couple minutes with very little discomfort. So today we have our patient Abby here who's been very gracious and allowed us to record this procedure today. So do you mind just letting the audience know a little bit about your nose?
It's huge. And I've wanted a rhinoplasty since I was like 10, and I've been researching like liquid nose jobs, and it seems like a pretty quick and easy procedure to do rather than going under the knife and spending thousands of dollars. So I'm gonna try it out.
Yeah, so we had a discussion about goals and what changes she wanted to be made to the shape of the nose. So what I always counsel patients on is that we can't make the nose smaller with filler, right? We're adding volume to the nose. But what we can do is change the shape of the nose, change the profile of the nose, and give it a more aesthetic appearance in just a few minutes, all right? So we'll get started. We've already been numbing for about 30 to 45 minutes with a topical cream. We've already treated the skin and cleansed it with alcohol as well. So this is a hyaluronic acid filler I'm using today. The reason I use this is because it's reversible if, say, we don't like the result or if for medical reasons we need to dissolve it. Some providers will use a calcium hydroxyapatite filler, which lasts longer and gives a little bit more lift, but then it's more permanent. So I typically start at the radix, and that's this part of the nose up here, and we want to come right at the deep fatty layer. So you'll feel a small pinch here, okay? Just bear with me. And then we'll just stay in the midline and slowly inject. And you might hear a little pop. As it goes. And the trick is just nice and slow, gentle pressure. There's no rush with this. Okay. And a lot of the time, we want to feel where the filler is as well as look. It's both. You want to use your fingers to feel and also your eyes to see. Can you turn your head toward me slightly? Perfect. We also want to see the nose from every angle, right? Has to look good on profile, also in the front, also in oblique views. So we check everything. I'm gonna do just a little more up here. How are you doing?
Fine. Great, actually.
Not too painful, right?
No, I can't even feel it.
Yeah. Gonna hold pressure for just a second here. Yeah, you're doing awesome. So again, with this injection on the nose, we want to stay in the deep fatty layer where there's very few blood vessels. So the danger with this is that if you go too superficial, you can get into a blood vessel that can damage the skin, or even in very, very rare cases, cause some vision loss. So we've already discussed those risks. And that's why it's important to have a physician who's experienced in this and knows their anatomy. do a little in the nasal tip here, okay?
Mm-hmm.
Pinch. And this filler has lidocaine mixed in with it, so as we go, the nose numbs more and more and more. So I'll do a little bit here, okay?
Mm-hmm.
Can you turn toward me again slightly?
Mm-hmm.
Great. A little bit more here. A little bit of pressure here. Now the result with this should last about a year. That's on average. Some patients get less, some patients get more. The filler we're using is a little bit stiffer, so I'm hoping to get about 12 to 18 months out of it, but everybody metabolizes filler at a different rate. So you can see we already have some rotation of the nose here. We have a little bit of a tip coming in here. Can we take a look at that? You can already see the shape of the nose is now going upward, right? So I'm just gonna continue to just try to refine as we go. So I can still see a little bit of a bump here. So what I'm gonna do is try to disguise it a little bit more. I'm going to give you a little bit more up here, okay?
Mm-hmm.
some alcohol to clean. So we've used one syringe, and oftentimes, depending on how drastic of a change we want, one is sometimes good enough, sometimes we need a little bit more, sometimes a little bit less. But overall, you can already see changes to the shape of the nose. So I'm just going to hold a little bit more pressure here. The pressure just goes a long way to reduce bruising and swelling. Even just a minute goes a long way. You doing okay?
Yep.
Yeah? How's the pain level, would you say?
Like a 2.
A 2? Yeah, that's pretty typical actually. Okay, here we go. So I'm going to hand you a mirror, all right? Mm-hmm. So we've done one syringe. We can always add more if we need.
Okay.
Let me know what your thoughts are. It's good.
I love it.
Oh my god. Oh my god.
What was that, maybe 10 minutes?
That's amazing.
Yeah, so what we'll do is, I think we'll stop here today, and then we'll let what the filler's going to do is it's going to pull in water and settle. So what we'll do in a week or two is fine tune with a lighter filler just to really address any shadows or creases or small irregularities, all right?
Mm-hmm.
All right, good job.
Thanks, my hand's really sweaty.
All right.